Welcome to Nursing Pine YouTube channel. Today we are going to talk about physiological basis of nursing practice, question and answer. The first question is, an intravenous fluid is infusing more slowly than ordered. The infusion pump is set correctly. Which factors could cause the slowing? Select all that apply. Infiltration at vascular access device site, patient lying on tubing, roller clamp wide open, tubing kinked in petrils, circulatory overloaded. Answer is 1, 2, 4. The second question is, which patients does a nurse plan to teach regarding water restriction? A 23-year-old with extracellular fluid value deficit, a 34-year-old with hyponatremia, a 47-year-old with hypercalcemia, a 69-year-old with metabolic acidosis. The answer is B. The next question is, a nurse assess pain and redness at the vascular access device site. Which action take first? Apply a warm, moist compress, monitor the patient's blood pressure, aspirate the infusing fluid from the VAD, stop the infusion and discontinue the intravenous infusion. Answer is D. The next question is, when delegating input and output measurement to nursing assistive personnel, a nurse instructs them to record what information for ice chips. The total volume, two-thirds of the volume, one half of the volume, one quarter of the volume. Answer is C. The next question is, a nurse assesses 4 patients. Which patients has greatest risk for hypomagnesemia? A 72-year-old with chronic alcoholism, 79-year-old with bone cancer, a 41-year-old with hypernatremia, a 46-year-old with respiratory acidosis. Answer is A. The next question is, which assessment does a nurse interpret as a transfusion reaction? Crackles in dependent lobes of lungs, high fever, severe hypotension, anxiety, itching, confusion, chills, tachycardia, and flushing. Answer is D. The next question is, what assessment does a nurse make before hanging on intravenous fluid that contains potassium? Urine output, atrial blood cases, fullness of neck veins, level of consciousness. Answer is A. Next question is, the healthcare provider's order is 500 ml 0.9% NaCl intravenously over 4 hours. Which rate does a nurse program into the infusion pump? 125 ml per hour, 167 ml per hour, 200 ml per hour, 1000 ml per hour. Answer is A. Next question is, an older adult patient is receiving intravenous 0.9% NaCl. A nurse detect new onset the crackles in the lung bases. What is the priority action? Notify a healthcare provider, record in medical record, decrease the IV flow rate, discontinue the IV site. The answer is C. The next question is, place the following steps for discontinuing intravenous. Assess in the correct order. Perform hand hygiene and apply gloves. Explain procedure to patient. Remove IV site dressing and tape. Use two identifiers to ensure correct patient. Stop the infusion and clamp the tubing. Carefully check the healthcare provider's order. Clean the site. Withdraw the catheter. Apply pressure. The answer is F, D, B, A, E, C, G. The next question is, a patient has severe hypercalcemia. What are the priority nursing intervention? Fall prevention intervention, teaching recording sodium restriction, encouraging increased fluid intake, monitoring for constipation, explaining how to take daily weights. The answer is A, C, D. Next questions. A patient has hypokalemia with stable cardiac function. What are the priority nursing intervention? fall prevention intervention, teaching recording sodium restriction, encouraging increased fluid intake, monitoring for constipation, explaining how to take daily weights. The answer is A, D. The next question is, a patient is admitted to the hospital with severe dyspnea and wheezing. Atrial blood gas level and admission are pH 7.26, PaCO2 55 mmHg, PaO2 68 mmHg, and HCO3 24. The nurse interprets these laboratory values to indicate metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. The answer is C. The next question is, which assessment does a nurse use as a clinical marker of vascular volume in a patient high risk of extracellular fluid volume deficit? Dryness of mucous membrane, presence or absence or edema, fullness of neck veins when supine, fullness of neck veins when upright. The answer is C. Next question is, a patient is hyperventilating from acute pain and hypoxia. Intervention to manage his pain and exhaustion will decrease his risk of which acid base imbalance? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. The answer is D. Thank you for watching.